Welcome friends, welcome colleagues, welcome medical students to MuniMeterHealth, your favorite source of learning about human heart and cardiology. So welcome again, this is Dr. Jaitly on MuniMeterHealth. On this brief video chapter, we're going to be talking about what are the stages and functional class of heart failure, okay, also known as HF in future. So now let's understand what the possible stages can be. Well, obviously we start with a stage A, go to B, C, and then D. That's easy. Okay. Now stage A implies that there is no structural heart disease yet. In other words, if you were to look at it microscopically into these myocardial segments, you will not see any structural heart disease yet. Neither would it show up on any of your testings, including echocardiography, which is commonly done for anatomical and a functional test as what it is in a non-invasive ultrasound setting. So, but nevertheless, there are cardiovascular risk factors. And those factors may be like hypertension existing, or diabetes, or even high lipids, and what have you. Maybe a patient is a smoker, or a patient has a strong family history. So these are some of the considerations that stage A patients should classify under. In other words, they are high-risk individuals. As I said, cardiovascular risk is existing, but no damage done yet. Done. Stage B. Stage B implies that there is structural heart disease now present. Okay, so that means now these patients, they have started to develop either an LVH based on if they were hypertensives. Maybe there is some asymptomatic LV dysfunction now starting to occur. The ejection fraction used to be 55, is down to about 50, but the patient is not having any symptoms. So no symptoms, very important. So no symptoms yet. Obviously, these risk factors are existing. You have advanced this patient to stage B, but there are some structural changes now starting to occur. Say, nevertheless, whether you do an echo or maybe even microscopic myocardial segments, perhaps on a biopsy might show up things. So again, but there are no symptoms yet. In stage C, you have symptoms now. Symptoms are present, and these symptoms are either current or they are past. Remember that. They may have past history of shortness of breath, fatigue, ankle edema, but now, they are compensated. So this is where the therapy begins. So you may start some therapy regimens. Again, not very aggressive, but the very fact that these patients may belong to ACE and ARBs, or ACE or ARBs, and or beta blockers. Remember, beta blockers are essential to the cornerstone therapy for heart failure. So stage C, invariably they become asymptomatic once you institute these therapies, and that's why I said symptoms may be current or they may be in the past. They may not be present at all, depending upon how the therapy is working on them. Obviously, the echocardiographic changes will be present where the LVEF may be further down to 40%. Okay, so it's further down, and there might be LVH and other stigmata of other etiology that one can ascertain. Some myocardial segment, we call it, wall motion abnormalities on our echocardiographic notation that we offer. So wall motion abnormalities are present, and LVEF is down to 40 or less. Now in stage D, that is considered, obviously the symptoms here are present, sometimes even at rest. Remember that. So symptoms must be present at all times, and these patients have end-stage heart failure, we call it, or end-stage cardiomyopathies. So we can call it cardiomyopathies. And these patients require intensive, remember that, they require intensive therapeutic regimens. Like sometimes they may be in a cardiogenic shock. They may require IV inotropes. Or they may be candidates for cardiac transplants. So they may be candidate for cardiac transplant. They may be amenable for maybe cabbages and PCIs or what have you. So other interventions, or maybe an ICD interventions may have to be done. So these are end-stage heart failure patients, and these patients invariably fall with an EF of 35% or less. So here the EF is less than 35. Here the EF is about 40, and here it may be an asymptomatic LV dysfunction. Remember that, but these patients have a borderline EF of 50 if you were to look at an echo, and here the EF is totally normal, more than 55. So more than 55, we can write it here. Here's borderline 50, if you will. So these are the EFs based on echoes if you were to look at. Now, having understood these, now let's understand what the classifications by the classes. Now, the functional class is very easy. Stage 1, we can use another pen here if you like. Stage 1, for instance, then you have stage 2. We are going to the right side of the panel here, watch me, 3, and then stage 4. So these are the functional classes, okay? And what are the functional classes? Class 1 implies that there is no physical inability to walk or exert. In other words, patient has no symptoms on physical exertion, on ordinary exertion. In other words, if somebody was to do an ordinary physical activity, there are no symptoms. Okay, so on ordinary physical activity, no symptoms, we'll call it symptoms-less. In stage 2, or class 2 rather, you have ordinary physical activity which is normally considered as 2 to 3 blocks of walking. Just walking, not running, or maybe a flight of stairs, and patient has symptoms. Okay, so symptoms are present. Here, class 3, very simple, you're walking less than 2 blocks. Remember, now you're not even able to walk a flight of stairs. Now that is less than an ordinary activity, because in the house sometimes people have stairs and they can't walk. Or sometimes they can't even walk up to the driveway and pick up their mail or newspaper, etc. So the whole idea is wanting to ascertain that these patients have class 3 because they walk less than 2 blocks and the symptoms are present. Again, symptoms are not at rest, but they can be provoked by less than ordinary activity. Here, the symptoms are present only when you exceed the ordinary activity. And stage 1, ordinary activity, there are no symptoms. And stage 4 implies that there is rest dyspnea. In other words, these patients have angina or dyspnea or shortness of breath, as I said, and sometimes even PND, which is considered at rest, obviously. So PND is considered as class 4. So these patients have symptoms and even at rest. So obviously, if you were to look at the functional classification, that goes by the New York Heart Association dyspnea classification. So this is the New York Heart Association dyspnea classification, which defines the functional class, and the stages are defined here. A, B, and D here. As I said, these are the stages. Okay, so in a nutshell, so you've learned about how do you classify by stage, how do you classify by functional class, the various heart failures. Okay, so again, it was a short video only to, for the sake of the students to refresh, and of course, colleagues like me will go back and teach and learn together. So, feel free and write some comments, your questions, and of course, if you like this short video chapter, do press the like button. We'll appreciate that. Thank you again. This is Dr. Jaitly from New York. So long.